हे गाइस, वेलकम टू माय चैनल। आज हम स्टार्ट करने जा रहे हैं बैक ऑफ द मसल्स। जितनी भी मसल्स हैं बैक की, वो सारे आज कवर करने जा रहे हैं हम।
So we are starting now back muscles. Attachment of the muscles connecting the upper limb to the vertebral column. First muscles trapezius. Origin medial 1/3 of superior knuckle lines. External occipital protuberance. Ligamentum nuchae. C7 spine. 1 T1 to T12 spines corresponding supraligament. So here you can see this is superior knuckle lines. This is 1/3 medial 1/3 portion. Uh, this is ligamentum nuchae, C7 spine, uh, T1 to T12 thoracic region तक segments. This point can be felt easily, which is known as external occipital tuberance. You can feel it on the back side of the head. So, trapezius key insertions. Upper fibers into the posterior border of lateral 1/3 of clavicle. Medial fibers into the medial margin of the acromial process and upper lip of the crest of spine. So, here in this diagram, this is the clavicle, this is the lateral end, this is the medial end, this is the posterior border, this is the anterior border. सो पोस्टीरियर बॉर्डर पे ट्रिपीसिस लगी हुई है मसल जो अटैचमेंट है यहाँ पर और ये लेटरल 1/3 है पार्ट ऑफ क्लैविकल। तो सभी का अपर फाइबर वाला तो क्लियर हो गया होगा। अब मिडिल फाइबर्स देखते हैं। मीडियल मार्जिन ऑफ द एक्रोमियन प्रोसेस। मीडियन मार्जिन of the acromion process. This is the median margin of the acromion process and ये यहाँ से लेके यहाँ तक पूरी ट्रिपीजियस की है अपर लिप जो है और लोअर फाइबर्स ऑन द एपेक्स ऑफ ट्रायंगुलर एरिया एट द मीडियल एंड ऑफ द स्पाइन। तो दिस इज द एपेक्स। सो हियर इज आल्सो अ lower fiber of trapezius which are attached to it. Final part. Branches from the C3 and C4 proprioceptive nerves. Action. Upper fibers acts with levator scapulae and elevates the scapula as in shrugging of shoulders. Upper fibers of both side extend the neck. Extension of neck करवाती हैं. Medial fibers acts with rhomboids and retracts the scapula. Serratus anterior and rotates the scapula forward around the chest wall, thus playing an important role in abduction of the arm beyond 90 degree, steadies the scapula. So हमारी second muscle जो है latissimus dorsi है. Posterior 1/3 of the outer lip of iliac crest, posterior layer of lumbar fasciae, thus attaching the muscle to the lumbar and sacral spines. Spine of T7 to T12 lower also covers lower four ribs. Inferior angle of scapula. So here you can see in this diagram, this is the iliac crest, and this is the posterior part, uh, the latissimus dorsi, which is attached to the iliac uh, upper lip, outer lip of the iliac crest, 1/3 part, only 1/3 part, not all. Fasciae, which are thus attaching to the muscles of lumbar and sacral spines of vertebrae. So this is also the spines T7 to T12, which covers by latissimus dorsi and also inferior angle of scapula. Insertions of latissimus dorsi. The muscle winds around the lower border of the teres major and forms the posterior fold of axilla. The tendon is twisted upside down and inserted into the floor of the intertubercle sulcus of humerus. So in this diagram, you can see this twisted tendon of latissimus dorsi. So this which is inserted into the floor of intertubercle sulcus between two tubercles, greater or lesser tubercles. Nerve supply of latissimus dorsi. Thoracodorsal nerve from C6 to C8. Nerve to latissimus dorsi, which is also named. Action: adduction, extension, and medial rotation of the shoulder, as in swimming, rowing, climbing, pulling, folding the arm behind the back, scratching the opposite scapula, essentially a climbing muscle. Now, the third muscle, which is levator scapulae, origin, transverse process of C1 and C2, posterior tubercles of transverse process of C3 and C4. Now, come to the insertion. Insertion, superior angle and upper part of medial border up to triangular area of the scapula. This is the scapular diagram of muscle attachments. This is the levator scapulae. This is the superior angle and the upper part of the medial border up to triangular area of scapula. So come to the nerve supply. A branch from dorsal scapular nerve, which is C5, branches from the C3 and C4. Action: helps in the elevation of scapula, studied the scapula during the movement of the arm. So come to the fourth muscle, which is rhomboid minor. Origin: lower part of the ligamentum nuchae, spine C7 and T1. Insertion: base of the triangular area at the root of the spine of scapula. Nerve supply: dorsal scapular nerve, which is C5. Also action: retraction of scapula. So lower part of ligamentum nuchae and the uh, origin is spine C7 to T1, which is attached origin of rhomboid minor. So come to the insertion part. This is the base of triangular area at the root of spine of scapula. This is the spinous process and this is the root of spine of scapula. So fifth muscle is rhomboid major. Origin spine of T2 to T5, supraspinous ligament. Insertion medial border of scapula below the root of the spine. Nerve supply dorsal scapular nerve, which is also C5, and same as compared to rhomboid minor. Action is retraction of scapula. So here is the spine T2 to T5, which is origin of rhomboid major muscle. So this is also a scapular diagram. So this is the rhomboid major part, which is medial border of scapula below the root of spine of scapula. Thanks for watching my video. See you soon.